good afternoon, everyone. Thank you so much for being here today. My name is Kendra Lee. I'm the Associate Director for Access here at the Atlanta VA, and this is our first Access Veteran Forum. We are so glad that you are here in person and online. Yeah. A couple things I wanted to share. I wanted to thank our Medical Center Director, Mr. Kai Mentor, for allowing us this opportunity to share with you some of the updates and the things that we're doing, changes that we're making, and also give us an opportunity to hear from you directly and allow you a chance to meet with our staff who are addressing all of your access concerns. Also, I would like to go ahead and just apologize for anything that happens that we can do better on. So, I know that there are a lot of people who may not have heard about this. Again, this is our first one, so we are trying to get the word out. It's not on our normal regular schedule, and it's something new and different. So if you have friends, if you have other veterans that need to know about it, and we weren't able to get them this information, please let us know so we can work on better ways of providing this information. We are also aware that there were some traffic issues getting here today. We did not plan that. So again, we apologize, but we are grateful for the folks that are here and on the line. Before we get started, I wanted to kind of set the theme of our conversation. Here in the Atlanta VA, we have a lot of change going on. We have new leaders in all various positions. And even the position that I'm in is it's a brand new position. There are only two associate directors of access across the nation, and I'm one of them. And so the reason why we have this position is because this is an issue that's very important to us here at the Atlanta VA, and it's something that we want to get right. So with that being said, we are focusing on progress over perfection, right? We want to make the changes. We want to get things right. We're not going to be perfect all the time, but we are striving towards that perfection, and we're making small steps every day. Thank you for your patience. And we want you to know that we're on your side, okay? And it may not always feel like that, but we're striving to be your battle buddy, not the person not the mission, if that makes sense. We're on your team. We are here to make things better for you. So that's why we're setting up these new initiatives. We're making a lot of changes. We want to share with you some things that you proactively can do as a veteran to help us better serve you. And again, we're creating an opportunity to hear from you and your concerns. And last but not least, we are persevering towards improved access. So our goal is to get more appointments. Just in the last couple of months, we had a project that was led by our primary care team where we were able to create 75,000 appointments. That's a huge increase for us. And so we're looking to find that all across the facility, all across the agency. So bear with us as we're making those changes. They may not always come out the way we want to the first time, but they will get better. I did want to let you guys know a couple of things as far as how we're going to move forward today. We have an agenda that we're going to go through, and I'll do the introductions as people come up. But we want to make sure we have an opportunity to speak with everyone. So if you have questions, we will have individual people in the back that you can reach out to provide specific information. We don't want you to share your social or your birth date or anything like that, because this is live, it's being recorded online, and so we don't want other people to have your information. So be careful with that. But other than that, we'll go ahead and get started. So first we will have Dr. Hollis from Community Care. She is our chief nurse for Community Care.
All right, good afternoon. All right, so I wanted to reach out to the veterans and do this education because many veterans get confused about a consult, and then they get very upset because they think that it is in community care. So what I have heard is that veterans don't really understand the process of getting over to community care. So I'm going to go through the process and help you all understand the flow, because consult is a word that is used loosely. All right, so you have a consult. Now what happens? Your primary care physician says, I am going to give you a consult to one of the specialty clinics. And you say, okay, I need orthopedics as example. You leave and you're like, yes, I've got a consult. Community care never calls me. I don't know what's going on. The consult is not coming to community care immediately. When your provider says, I'm giving you a consult, it means he's sending the consult to the internal specialty clinic. The internal specialty clinic will then outreach to you as the veteran, and they will say, we have a consult for you. We would like to schedule care. At that point, you're thinking, well, I really want to do it in the community, don't want to do it there, but you need to really take note and listen to the scheduler on the phone. If you do not meet for drive time, then they will take a look and see what is their next available appointment. If that available appointment is outside of the 28 days, then they will start taking a look, do you get to go to the community on wait time? If that is not an eligibility that you meet for, so you don't meet for drive time, you don't meet for wait time, then they are going to schedule you in the clinic. Don't get upset about that. Attend your appointment, whether it's through Video Connect, telephone, or whether you need to drive in and see that provider to have that next discussion of how much care am I going to need? Am I still able to go to the community? And your provider will have a discussion with you about, is the next step community care, or can they provide you the care at the VA, right? Once that determination is made with that person on the phone, so please, as a responsibility of the veteran, answer the call. Because if you do not answer the call, they're going to send you a letter, an unable to contact letter. When that letter gets to you through the mail, and we don't have a timeline on the mail system, if you don't respond and call the clinic, they will cancel that consult and assume you do not want the care anymore because you did not respond. All right. So let's say you get the letter late and you're like, oh my gosh, I still want that care. That is okay too. You can pick the number off the sheet that you've got for the unable to contact, call them and say, I still want the care. And they will move forward with it. Okay. You just need to do it within 30 days. All right. All right. So eligibility is reviewed at the time on the phone. All right. So remember, if you don't meet for drive time, you don't meet for wait time, you still need to have a conversation with the provider. All right. Once that's determined, you'll either get your care in the VA if it's not eligible for community care, or they'll forward it to me. And then once it comes to me, we have 3 days to check it out, make it active, 30 days to schedule it. And I know everybody's like, oh my God, my consult's a lot older than that. So that is correct. We have been striving in community care to bring down the wait time for the veteran, and we have successfully taken it down. And we are at about 39 days right now. Okay. So don't get concerned. If you know the provider you want to use in the community, you can send us a secured message and say, hey, community care, I know you have my consult, and I would like to use orthopedist so-and-so at hospital A. Could you please assist me? And then we will pick that up in secure messaging and we will move from there. All right, so I don't want the specialty clinic. I do not have eligibility for community care. What are my options? Again, you need to first schedule. During the appointment, you'll discuss that with the provider. If there's no eligibility, then Mission Act has not been met. Okay, that is a discussion between you and the provider. If you do not have eligibility, talking to the scheduler on the phone is not the method. All right, that individual cannot make your consult eligible. That would then need to come from the provider. Okay, all providers in the VA are experts. I would like to say that again. All VA providers are experts. They have been selected, they've been credentialed, they have been reviewed, they have gone through all of the licensing and accreditations that they are needed. Many of them moonlight in the facilities outside of the VA. So when we hear you can't care for us and the providers don't know enough about my situation, that's not true. You have to go and see your provider and allow them to look at it and say, am I going to be able to see you weekly? Am I going to be able to see you monthly? Do I need to see you every 6 months? What is that care? But we do hire experts. So I would like to just reiterate that. All providers in the VA are experts. All right. So once it comes to community care, we will then schedule for you and get you on your way. All right. All right. Billing information. This is a very sore point. We get lots of complaints through My Healthy Vet, and yes, they are complaints. We never want to bill, but it does happen. All right. And so, sorry, we're on prescriptions. So prescriptions in the community are also a sore point. So prescriptions, you can get them under urgent care needs, but it's 3 to 7 days. All right. If it's long-term medications such as hypertensive meds, needs to come to the VA. Can you go to the next screen? Thank you. All right. So for pharmacies, they're not going to fill if it's a long-term medication. That needs to come through the VA. All right. And so with the VA, the provider in the community needs to fax or e-fax the prescription. It will then come to the VA. The pharmacist will pick it up. They will take a look at it. They will see if it's on formulary. If it's not, they will reach out to you and let you know that there's a different medication that we use. If it's on formulary, they will package it and they will send it out to you. Okay. So when we're looking at information for pharmacies, when Community Care sends out the referral packet, we send all of this information to your provider as well. But you have to remember the provider's not getting the packet. It's the back office people. Okay, so your provider's like, I'm seeing the patient, but your back office people are the ones with the packet. Okay, so you got to remind the provider, hey, I need for you to fax this over to the VA pharmacy. They will accept that script and they will move it forward. All right, so all prescriptions must be e-scribed, all right, assigned, and then they'll be assigned to a VA pharmacist and they will take it from there. If you receive a prescription, bring it to the VA, all right? So if it's going to be a long-term script, you need to bring it to the VA, all right? If you are not near the VA medical center to drop it off at the local pharmacy, you can take it to your CBOC or to your clinic and you can ask them to please fax it down to the pharmacy. But it shouldn't be the veteran's responsibility to get it there. It should be done through e-fax and the community provider should be following the instructions that were given. So if you are at your appointment and they try to hand you a prescription and you say, well, I really would prefer for you to send this to the pharmacy at the VA, and they say no and hand it to you, you can take it to the nearest CBOC and they will scan it in and send it over to the pharmacy for you. If you have a person that says, no, I'm not going to do that for you, please just let us know. We will move forward from there because we should be making every effort to assist to get your scripts down to the VA pharmacy, okay? They will not take it from you or from a personal email. So it either comes from the clinic or it comes from the provider in the community, all right? All right, next screen. All right, self-scheduling. I did receive a comment when some of our team members asked a veteran if you would like to self-schedule in the community. And the comment we got back was, what? I now got to do your job? Self-scheduling is allowed. And what self-scheduling is it's a letter. So you tell us the prescriber that you, or the preferred provider that you already know, and you may already have a relationship with him. Maybe you've been seeing this cardiologist under private insurance and you want to move it to community care now. So with that, we would send you a letter and we will give you a temporary authorization. We will give you 7 to 14 days to call the provider, make the appointment, and then through secured messaging, send us the appointment and the provider date and time back to us. We will authorize and complete the packet and send it over. That is self-scheduling, all right? You don't have to do it though. All right, EPS. This is the external provider scheduling system. This is what the Senate has been talking about since January. This system allows providers to give us so many slots on a calendar to be able to say, we're going to put veteran A in this spot because he needs physical therapy. And he wants to use this particular vendor that has opted in to the external provider scheduling, all right? So we are getting more and more providers to sign on. And what this process does is it allows us to leave off the vendor and the back and forth. It speeds up scheduling because when my team member calls you and says, hey, would you like to go ahead and schedule? And you say, yes, I want to use this vendor. And she says, well, I see them right here in EPS. Would you like to go next Friday? 2 o'clock. No, that's not good for me. Okay, I've got another appointment on Tuesday at such and such. Would you like that one? No, that one's not working. And then they can go through the scheduled appointments that have been given to us already so that we can get you in, get the packet over to the provider, and get you scheduled faster. This system right here is what we're pushing for. We are third in the nation in Atlanta for using it, and we are trying to use it more and more each month. All right? So that's 2 ways that the veteran can help us with scheduling as well, is to answer the phone. Look at your secured messaging. If you do not have secure messaging, please work to get it. We do communicate quite a bit through secure messaging with our veterans because the mail is not delivering our information in 21 days or less. Okay, and so sometimes you may not get your authorization, which is needed for your appointment, because the mail didn't run as fast as we anticipated. All right, so it is very important that the veteran answers the call. All right, next slide. Billing. Here's my sore point. All right, copays and balance billing. You do not owe a copay when you go to the doctor. Okay, you do not owe a copay. You might get one from the VA, but we take care of that with you, not the vendors in the community. Okay, so you do not owe a copay. If you pick the phone up and they say, oh, veteran A, you owe a copay, you should ask the next question. I'm so sorry. Are you using my private insurance or did you get the request from the VA? Because I don't owe a copay under VA pay. Okay, that is prohibited. Balance billing. What is balance billing? We've started seeing a little bit of this creep up and we've had to intervene. Balance billing is where you may go to a provider and they say, here, we want you to sign this because whatever your insurance doesn't pay, you still owe us. That's balance billing. Whatever's negotiated in the contract with Optum, that is what they get paid. They cannot come back and say, well, you were paid, Optum paid $275 for my care and you owe $125. No, that is prohibited. Okay, so no balance billing, no copays in the community. Community providers are not authorized to charge copays, cancellation fees, no-show fees, or balance bill fees to the veteran. Okay. Ancillary services such as DMV, FMLA, work and jury duty excuse letters are not covered under Optum. So what does that mean since I just said you don't owe anything in the community? What that means is if you have any of these items that you need and the doctor says I charge $30 to fill out FMLA paper, you're going to owe that. All right, so you probably want to think about who's actually going to fill that out. Probably your VA primary care provider. Okay. If a veteran elects to receive a non-covered service, we have seen this to where we've had veterans go into the doctor's office, we've sent them there, and they walk in and they say, oh, well, I want this instead of that. Well, it's not covered under Optum. Okay, you will owe that if you opt in to make changes to your care that is not covered under Optum. How do you know what's covered? It's on the CEOC. Your provider gets that CEOC. They take a look at it. We do get a lot of questions from the providers to make sure they're not overcharging and billing the veteran for care that's not covered. All right, and so they're pretty quick about it. So we don't see it a ton, but we've seen it twice in the last year. Okay, so just make sure that you get a copy of your authorization, either through mail or in secure messaging is the best method, so that you can look at it and see. And if you have any questions about what's covered, please send a secure message and just ask, hey, I need to know if this is covered under this. That's fine. Your providers are very knowledgeable in the community and they know that they can go and ask provider questions directly to Optum. All right, if you don't wish to wait for us. All right, that's the last one. And our next person up is Mr. James Dumas from HAS.
Thank you, Dr. Hollis. All right, good afternoon, everyone. All right. Well, a few things I want to speak to you about, as she stated. Well, first, I'm James Dumas, the Chief of Health Administration here at the main facility here. Pretty much, we handle all of your schedulers. We're in charge of all your schedulers here in the hospital, as well as out in the C box. We want to briefly speak about Vet Tech. Vet Tech is basically an appointment reminder. Within Vet Tech, it actually it does not include locations for your appointments automatically unless you're within that non-PHI. If you're utilizing non-PHI, then Vet Tech will actually give you the appointment and clinic name and location. All right, getting location. Now, everyone don't necessarily have to utilize Vet Tech in order to get these appointments. If you do not, if you want to start it first of all, just make sure that you are linked to Vet Tech. And with going into Vet Tech, you would use your last 5 digits of your zip code, place that into Vet Tech, and it will actually give you the prompts in order to give you the information that you need as far as you're getting the location. Now, some veterans already in it. If you by chance want to opt out of it, once you receive that text message, then just reply back basic, and that will stop you from getting those messages, and you do not have to no longer utilize that particular portal. Vet Tech, it also is one of the tools that we use in order to get urgent messages out, such as flu shot reminders, if we're having inclement weather, things of that nature comes through Vet Tech. Next slide. Okay. Open slot management. Some of you have heard about open slot management. Open slot management, basically, there you have two options there in Open Slot Manager. When Vet Tech sends you that message, you have the option to either reschedule your appointment or cancel your appointment. Now, with Vet Tech, if you actually want to opt in to reschedule that appointment, then you just go ahead and type reschedule in. It will send you a confirmation that your appointment has been rescheduled through the system itself. If you want to just keep that same appointment, then very simple. All you're required to do, answer that call, reply back within a 2-hour time period, and type in the word keep, and it will keep that appointment for you. Next slide. All right, automated telephone confirmation. We do use several different modalities to try to reach out to the veterans. Here you find what we call audio reminder, which is one. With that audio reminder, it reminds you of any upcoming appointments that you may have. It also enables you to go ahead and put in any information that you would like to discuss with your provider for that appointment. And also there's an indication for cancellations that would automatically, if you choose to cancel that appointment, you put in the cancellation, it will automatically cancel that appointment for you. Another modality there is audio communicator. The audio communicator is a tool that we normally uses to reach out to veterans during times of inclement weathers, if there is a delay in that clinic opening that day, or even if there may be clinic closures. That comes through our audio communicator. Next one. Okay. Here we will find another modality a lot of you are very familiar with, which is our postcard mailer. We send out these postcards to remind the veterans of their appointments. On the postcard, you will find information on there such as the date, the time of your appointment, the exact clinic that you should be reporting to, and the location. It may not be here at the main facility. It may be at one of our CBOCs. It will be stated there on that postcard. Now, one of the unique things about this postcard is if you see that we have a QR code that is on there. If you take and click on that QR code, it will actually give you the directions from your local address to get to your appointment. Next slide. All right. Self-scheduling. Community care does a great job with their program, self-scheduling. But however, I'm gonna have to steal their thunder. You all are not the only one, community care. Yes, we are doing self-scheduling as well. In which, with self-scheduling, one of my concerns once was self-scheduling. How is this thing going to work? But I'm glad you asked me that, because we definitely ensure that the way this program is set up, it is aligned with the VHA directives that covers and governing scheduling. All right. Now, with the self-scheduling, there are a couple of different ways, as you see here on the screen. It basically pretty much shows you your appointment. If you can actually see it there in the blue, it'll let you know exactly if that's a primary care appointment or whatever. And I'm gonna talk a little bit more about it, I think, on the next slide. Well, nope, it wasn't. But we're gonna go on to the transportation, veteran transportation services. All right. There had been a time where Atlanta VA was just in a very high demand for shuttles, in which we do have shuttle services that runs from the main facility to the Atlanta clinic Monday through Fridays from 6:30 a.m. to 5 p.m. Also, the North Fulton Clinic, you can request transportation service from out there here to the main. Now, you would actually have to request that service. It's not an automatic shuttle that just shows up all the time out there. And you can reach the travel department to set up that. All right. VIC cards. Talk a little bit about VIC cards. I'm very happy to know that we finally come up with a way to help service the veterans with getting VIC cards. Here in our enrollment section over between Monday through Friday from 8 a.m. to 4 p.m., 4:30 p.m., we actually take your photos, print out, get your cards printed. They actually mail them to you for those veterans that are in need of VIC card. On Tuesdays and Thursdays from 9 a.m. to 2 p.m., we actually have started what we call an outreach out at the CBOCs. We reach out, we actually go out to the CBOCs on Tuesdays and Thursdays and take photos in order for veterans to get their ID cards. We have a lot of, 23 CBOCs, and one of our complaints were that they would have to drive all the way into the main facility just to get an ID card updated. As you see here, it lists all of the CBOCs, the areas where we actually go out doing this outreach to print the ID card. This schedule here starts on August 5th and runs all the way through November 30th with the different CBOCs and the times that we will have staff out there in order to assist the veterans with getting ID cards. All right. ROI, release of information. First, let me make note, our release of information, veterans that are in need of your records, actually you present yourself here to the main facility, which is downstairs there in room G107. That is where you would go to get your records printed. However, down there at G107, we actually only work in that area to release records from the hours of 8 a.m. to 4 p.m. on Monday, Wednesdays, and Fridays. On Tuesday and Thursday, 8 a.m. to 12 p.m., you can actually go to the window there at GB 107 to request your records. Now, also, there's a little more to it. There's a couple of forms that you do have to fill out. As you see here listed, the VA Form 10-534 Alpha, that form will need to be completed by you, the veteran, if you're requesting your records. And the next form is the same form number without the alpha behind it. That is for third parties that are requesting to get your records. And we do have a 20-day turnaround time in order to retrieve those records. Next slide. All right. Here is just a snapshot of My Healthy Vet blue button. And one of my partners here, actually, he just told me no, he wanted to talk about this blue button to the veterans. So I'm gonna ask Mr. Michael Burden if you would come on up, sir, and give your spiel on blue button.
Yeah, thank you, sir.
All right.
And I won't be long, thank you. Just like Mr. Dumas elaborated, that 5345 is actually built inside of My Healthy Vet as well. So with the blue button, you can download all of your VA information, everything that we have on you dating back to January 1, 2013. Also, as a caveat, you can download portions of the DoD military information. So what sets VA apart from private institutions and our part of the military is that we give you information readily available 24 hours a day using the blue button. But what Kaiser won't give you is your mental health information, if those records. We do. What the Military Health Genesis records don't offer is your VA information. We offer that with the portions of it. So now what's happening is the VA actually merged the VBA and the VHA with the va.gov app. So inside of the app, instantly you can download your data on your phone and you can have access to your doctor's notes, your appointments, secure messaging, as Dr. Hollis talked about with community care. If you listen to her, she made a great speech and she said secure messaging 7 times. So they're in there. Travel's in there as well, as long as our great schedulers for HAS, they're in there as well. So you got access to us 24 hours a day. You can send us messages. And the beauty of secure messaging is more accountability built into that. And what I mean by it, we can't delete those messages. So we can't delete them. You can't delete them. After 14 months, they're purged into the My Healthy Vet database. And through our legal system, we can go back and retrieve those messages. So if you have any issues, or if you want to go back and review a thread, you have that with the touch of My Healthy Vet, downloading my data. I'm Michael Burton, I'm the Connected Care Program Manager, but Ms. Cherie Willis is the My Healthy Vet Coordinator. You have access to us inside of My Healthy Vet as well. And if you need access or need assistance with the login.gov, we're in the back ready to assist as well. Thank you, Mr. Dumas.
Hey, thank you, Michael. All right, next presenter we will have is our GPM, Mr. Yates.
Thank you, sir.
Yes, sir.
Good afternoon, everybody. First, I would like to say thank you for your service and thank you to those who helped our veterans that served. A couple of things I want to talk about today is the things that we are doing to help improve access for our veterans. First one is reducing wait times. What is that? The wait time is the length of time from the time that consult was entered to the time that you get your appointment. What we are doing with that is we're reviewing all of our provider grids, making sure that all of our providers are working up to their licensure and making sure that we have enough slots to get you in to that appointment. The next thing, labor mapping. All of our providers, to help improve their skills, they have education requirements. They are allowed to do research time, and based off of their level of their position, they have admin time. What we do in the group practice manager office, we look through that to make sure that there's not excess research time or excess admin time. So we work with the service, the providers, and the admin staff to make sure we got a good handle on that. Bookability. All providers that come here have an 80% bookability requirement standard, meaning that 80% of their employment have to be clinical. However, as they go on and do other things, that number will decrease as far as the number of slots they have. But what we do is make sure they have their minimum meeting that 80%. We are allowed to do 90% or even 100% clinical time, but bare minimum is 80%. Slot utilization, we actually share this. Hospital staff and our veterans, meaning we have a duty to make sure that all the slots that the provider have are used. What we're asking our veterans to help us with is any event that you have to cancel your appointment or no show, please let us know. And we're asking that you let us know as soon as possible, because then that will open up a slot for another veteran to get in. If you don't call and no show, which the next slide discuss that, then that slot go unfilled for a veteran that needed that slot. So what was there? I'm sorry. Yeah. So consult timeliness. The other thing that we're working on is making sure that when the provider enter that consult, there are 3 phases that consult goes through. That consult initially entered is in pending status. What that means is we're waiting for a provider to review that consult, add scheduling guidance so that the MSA or the scheduler knows what to do with that consult. Once that provider receives that consult, it is then in active status. At that point, that's when our MSAs, MSA supervisors, all of our, or scheduling, because scheduling is not only MSAs, but schedulers can then see it. They'll review the actions that the provider said have to happen for that appointment, be it a certain type of clinic or a certain time frame. Then they will schedule that, reach out to the veteran, and then get that appointment scheduled. Now it's in scheduled status. And then the last slide is the no-show rate. Again, this is an area that we really asking for our veterans to help us with. As Mr. Dumas pointed out, there are several different platforms that you can reach out to us to let us know if you're not going to be able to make it to your appointment or not. That is really important. Leadership, which Dr. Norvell is in the back, so he's looking at that. My immediate supervisor, Ms. Lee, is looking at that. So if we see something high, which is over 10% no-show rate for that clinic, we're asked to look into that clinic and find out what we need to do and improve so that the veteran know or have the information they need to be able to contact us to let us know they can't make it to that appointment. And that's all I have. So our next speaker is Mr. Bruton, another Navy man, so listen good.
Well done, Senior Chief. Really quick, my name is Gary Bruton. I'm the Regional Administrator for the West Region of our healthcare system, which goes all the way up to Blairsville, Georgia, down to Noonan, and from Cobb all the way over to Carrollton. So our job is for oversight and operational support of all the outlying sites, and we have 21 of them. You can go to the next slide. You'll see my twin brother, Mr. Miller. I'm a little bit taller, but he's better looking. So again, his on the East region, Atlanta, Tucker, Henderson, North DeKalb, Stockbridge, and our furthest south is Pike. I don't see, yeah, Pike County multi-specialty. So we do have multi-specialties down in Pike County. We have one in Cobb County. We have one AVC that offers specialty care as well as offers specialty care at those locations. So that's about it for that. And again, to repeat, my fellow Navy Senior Chief over there, you know, again, if we can get calls ahead of time to cancel your appointment, it opens up a slot for one of your fellow veterans. So thank you very much. Ms. Lee? Yes, ma'am.
All right, so before we go into question and answer, I just kind of wanted to summarize. I know that was a lot of information in a short amount of time. I do want to let you know that we are going to make the slides available. So if you didn't get something, you missed something, one, we have people here to answer questions on site, but two, we will make the slides available for everyone. One of the things that my team did not emphasize is that one of the things we're working towards is increasing our staff. A lot of the issues that we're running into is we don't always have enough people to meet the needs of all the vets that we have. And we have a number of vets that are moving to the Atlanta region. I see that you guys are calling your friends, telling them to move to Atlanta. And so we're trying to keep up with that number. And some days it's hard, harder than most. And so one of our biggest initiatives is our hiring practices and trying to get more people on site. But until then, we are looking at our processes. And so what a lot of what we share with you is how you can help us with the staff that we do have, try to make improvements, try to make things better for you all, okay? So, yep. And then one of the other things that I wanted to share is that we are creating a website for access. This website will have information from all of my direct reports, which are the folks that reported today, to give you any updates, any changes, forms you may need, things of that nature. The goal is to have that out early in the new fiscal year, so be on the lookout for that. It will be connected with our main website, so it'll make it easy access, but that just allows us to better communicate with you, let you know if there's any changes that come down that we need to get out as quickly as possible in between our opportunities to chat with each other. The last thing that I wanted to say is we have our chief of staff here today. And so I wanted you guys to know that we work closely with the chief of staff in his office, because as you can see, a lot of our success depends on their success. And so we want to thank Dr. Norvell for being here. And I just wanted to see if you had anything you wanted to share with the veterans. Okay. All right. So with that, we want to open it up to questions. So
we were late getting in here, and I don't know if y'all talked about the community care or not.
Yes, ma'am, we did. What particular question do you have about community care?
Do you have to go to a doctor that y'all assign, or if you have like a private doctor, can you go to them and be covered?
Yes, ma'am. So I'll let Dr. Hollis talk about that real quick.
All right, so you can get a consult with your internal primary care provider. It will then move over to the specialty clinic. The specialty clinic will take a look at it to see if they can give you care or if you have eligibility to go to the community. If you go to the community, you are allowed to select a provider that you have worked with as long as they are in network. So that's a great question. So she asked, how would we know if they're in network? When my schedulers give a call, or we outreach you through My Healthy Vet, that's 8. So we would then take a look at that. We would look at the provider that you give us. We would need his name and his address and his phone number. And then we would go into PPMS, which is our provider portal. I don't know the whole acronym, sorry. And so we would look in that portal, and then we would see if they are in network. All right. The other way that you can do it, if you just want to know ahead of time, because some veterans do have other insurance, and they'll use that insurance to be able to see a provider that they love, and we understand that. So you use that, and then all of a sudden maybe you're having life changes and you need to have the VA pick up the care. You can ask your provider, do you accept VA Optum pay? Do you accept veterans? And if they say, yes, we sure do, then you can come over to your primary care physician. You can ask him if you can get a consult, and it will move through the specialty clinic and then possibly come over to us. The VA could say, we have the ability to treat you. We do not want you to go to the community, and they may keep you. However, how can you get that consult to move a little bit faster so the doctor can take a look at it and make the decision? Bring the records. If we've never sent you to see that provider in the community, make sure when you come in to see your primary care provider, you bring those medical records so that when he writes for the consult and it moves to the specialty clinic, they can immediately look at those records and come up with, oh, he either needs to stay with that provider, maybe it's oncology treatment or something of that nature and it's not in remission, or, you know, I can treat you here, let's talk more about this. Okay? All right. Yes, ma'am.
If he goes to his private doctor and he writes him a prescription, he still has to bring it to the doctor here at the VA and let them look at it, or?
So no. So if the provider in the community, if we asked for him to go, that provider in the community should send it through e-fax over to the VA. I do know that the prescriptions are being handed to the veterans and they'll say, here you go, have a great day, and then you're battling to try and get it filled. But they should be sending it through eFax. So if you have trouble with that, you can outreach us and let us know, and then our vendor relations team will go out and talk to that provider and remind them that they should be sending it over electronically. If you do get one handed to you, you can take it to your closest CBOC or doctor, primary care provider. So like my husband is a veteran, he will go to the Marietta CBOC. He would walk in and present it there and ask the front desk, can you please fax this to the pharmacy? Yes, because you can't send it yourself, and we don't really want you driving out of your way to come to the Atlanta VA if you live, 80 miles up the road. So, we want to make sure that we're courteous. Yes.
The one skin, they referred him to a Tanner to have it done.
Yep.
Well, he had it done, it sat there, and it never got sent anywhere, so he had to go get it and bring it to his doctor. Is that the way it's supposed to work?
Was that the report?
Yeah.
So we do have some providers out in the community that believe that you have to do a release of information to send us the records, but that is not true. When we send out for the care, we're paying for the care, we own the results, and they should be sending it. But there are times where we're battling with them, and we have to help them understand with the use of Optum, this is within the contract, you are supposed to be sending us the records, where are the records? So I know in the past, community care had a records increase, but we have resolved that. So we are within 8 days of uploading records now, all right? And so it's still not within the 5 days, but we're getting there, all right? And so we're within 8 days. So next time, if you need assistance so you are not burdened with that, again, you can send secured messaging to us and let us know that where's the results, and we will outreach and go get them. And if they won't give them to us, then we will make the next steps of going over to Optum, and or we will give you a call and say, hey, they are saying you need to release the information, we've reported it. So, okay? All right, thank you.
Any other questions? Yes, sir.
I'd like to know, when I first started with the VA, I had my provider for 10, 15 years, Dr. Phelps, matter of fact, I'll call his name. He retired. So since then, it seems like every 6 months or a year, I'm going to a new doctor. Mm-hmm. And it's just like starting all over again. Mm-hmm. Is it they're not making enough money, they don't like the VA, or they just want to go to private practice, or what's going on? If you don't mind answering that question.
So that is a very good question. We do have a lot of turnover at the VA, and some of it is the VA is not easy to maneuver, right? And I think that's the case for a lot of people. We do have high expectations, and we hold people to high expectations. We, as Mr. Yates talked about, bookability, labor mapping, that's important to us. And so some people are okay with it and some people aren't. To your point, the community does pay higher. As a federal entity, we are not allowed to be the highest paid individuals. And so we have certain pay requirements because it's taxpayer dollars that are used to pay our bills. And so we have to be mindful of that. But what I will tell you is our providers work very hard, and they are dedicated to our veterans. We have a lot of our residents that come through our program that become doctors. And so we are looking to retain our providers, especially the best and the brightest, as we continue to develop the providers that are not only here, but also in the community. And so that is something that we're working on. I know that this is not something that just has impacted us as a facility. It's happening all throughout the healthcare industry, especially after COVID and a lot of life situations that have happened. There's been a lot of change, and people are really reevaluating, do I still want to be a doctor? Do I want to do this? So I don't think it's any one particular thing, and I don't think it's anything particular to the VA. I think it's just overall things that are happening in life. And so we're trying to be agile and work with our providers to make sure that this is the best place to work. But thank you for that question. Just know it's not you, sir. They enjoy working with you. Any other questions?
If we don't, it might be an opportunity to introduce who we have on the sidelines here that can be helpful.
Okay. So let's see. You're talking about the tables?
Yes, to
All
let
right,
folks know what's
so
available here.
on this, well, in the back corner, we have community care. Raise your hand, community care. Yay. On the other side, we have HAS. And just for clarity, community care, of course, is in the community, but HAS pretty much does the same thing internally for the VA system. So they're basically brother and sister service lines. In this corner, it seems like we have a lot of admin, but I know Mr. Burton and his team have a table as well to help with, in the back, sorry, to work with connected care and to give you information about My Healthy Vet, secure messaging, how to log in, things of that nature. One of the things we will be doing is when we develop our website for access, we're working on a video that we could put out to help veterans understand how to go through that process of logging on, creating your account. We all know that it is not the easiest thing to do. We didn't come up with it, I'll tell you that much. But we want to make it as easy as possible for the veterans to learn how to get into that system. And so we're working to get more information out for the veterans as well. Any other questions? All right, well, hearing none, thank you again for being here. Thank you to everyone who's online. We appreciate this. We will be having more town halls. We will make sure we get the word out a little bit more and a little better, because again, this is our first time. And we wanted to make sure we at least had one session this fiscal year. For those who don't know, the new fiscal year starts in October. So we wanted to make sure we met that deadline. And so more to come. But thank you for coming out today, and we look forward to talking to you guys in the room.